Each of you has heard this word at least once, osteoarthritis. According to WHO statistics, 60% of people over the age of 60 encounter it. Just think about that number. And the number of people suffering from this disease only keeps growing every year. Most often, it affects the knee and hip joints, which can ultimately even take away a person's ability to walk. But what can you do to minimize the risk of developing and progressing osteoarthritis? In this video, I'll tell you which methods actually work. Be sure to give this video a like. Thanks to that, YouTube's algorithms will show it to more people who also suffer from joint pain, so they can learn in time how to ease their condition and maintain their mobility. So, let me explain why I decided to make this video in the first place. In traditional orthopedics, the main treatments for osteoarthritis are painkillers, chondroprotectors, sometimes injections, and even surgery when the condition gets so advanced that the pain becomes unbearable. But to avoid reaching that point, we need to understand how osteoarthritis develops in our bodies. Osteoarthritis is a chronic disease. People commonly call it joint wear and tear. It develops with age and can also occur due to injuries or excess weight. Osteoarthritis affects the cartilage tissue. So what is cartilage? It's a tissue without nerves or capillaries. The main nourishment for cartilage comes from the blood vessels and capillaries located nearby, or from the blood that flows through the bone system, penetrating it to reach the cartilage, as well as through the synovial fluid. Cartilage cells divide very rarely, and even when there is no osteoarthritis, the matrix around the cartilage renews itself very, very slowly. And if there is damage or inflammation, the recovery process may not be able to keep up with the need for cell renewal. It is believed that restoring cartilage is almost impossible. Now imagine that osteoarthritis has started to destroy the cartilage. It can no longer fully perform its function, so some of the load from the joint is taken on by the tendons and ligaments around the joint. They also have poor blood supply. Gradually, as they become overloaded, they get inflamed and lose their elasticity. And when the inflammation lasts for a long time, the tissue becomes fibrotic, meaning it changes its properties and stops being as elastic and strong. As a result, the muscles start to suffer too. They begin to overwork and take on the load themselves, since the tendons and ligaments can no longer cope. Weakness of the quadriceps and gluteal muscles sets in, along with poor coordination. This is if we're talking about osteoarthritis of the knee or hip joint. The lower back suffers as well. The load on the already overburdened knee or hip increases, and the foot gets involved too. So what do we end up with? The muscles around the joint atrophy. The load gets redistributed. The joint exists in unfavorable conditions. This speeds up the progression of osteoarthritis even more. But it's not all bad. For example, I have a friend with stage 3 osteoarthritis who took a completely different approach. He plays soccer, and because of that, his joint isn't deteriorating. He's always moving. That doesn't mean everyone with osteoarthritis should rush out to play soccer. This is more of an exception than the rule. But here's what I want to say. In reality, movement is very important for the joint, even if it has osteoarthritis. It's just that the type of movement for each stage of osteoarthritis needs to be chosen individually. On the one hand, you can't overload the joint, but on the other hand, it shouldn't be completely inactive either. Because when the joint moves correctly, the cartilage gets stimulated, synovial fluid starts to be released, the joint receives nourishment, and cushioning occurs. That is, the cartilage is protected from damage. That's why, in the second part of the video, I'll give you useful exercises that are completely safe, but will help you maintain your joint mobility. So stay tuned until the end. And now, let's move on to what actually helps with osteoarthritis, not just relieves the symptoms. Knowing all this, we come to a simple conclusion. In order to prevent osteoarthritis from progressing, we need to load our joints properly. Numerous scientists and doctors from around the world agree with this as well. British studies from 2013 involving 8,000 patients with osteoarthritis of the knee and hip showed that aerobic and strength exercises reduce pain and improve function. Experiments from America and research from Australia showed about the same results. And one more very important discovery in recent years is the connection between osteoarthritis and our gut. Yes, you might be surprised, but there are several ways in which the gut can influence the onset of osteoarthritis. For example, in mice with disrupted microbiota or dysbiosis, to put it simply, osteoarthritis develops more rapidly. Transplanting the microbiota from healthy mice slows the progression of the disease. And in people with osteoarthritis, there is more often an imbalance in the microbiota, a decrease in beneficial bacteria, and an increase in conditionally pathogenic ones. That's why you should try to maintain gut health. Add foods with prebiotics to your diet. Oatmeal, barley, slightly underripe bananas, legumes, leeks, and garlic. And don't forget about probiotics. These include sauerkraut, kefir, and yogurt with live cultures. Now let's move on to some useful exercises you can start with in your daily workouts to support your joints. So, exercise number 1. Dynamic stretching of the ligaments and tight muscles of the knee. Lying on your back with your legs slightly bent, gently pull your lower leg up and down, then inward and outward to stretch the ligaments and relieve muscle spasms. Do 10 to 15 movements with each leg. The main goal of this exercise is to restore mobility, relieve spasms, and signal the stabilizing muscles. The second exercise is squats and half squats. This includes squats to a safe depth and lunges with support. They help distribute the load across the entire joint, as well as the surrounding muscles and ligaments. Half squats with support from the back of a chair or a wall. Feet shoulder-width apart, toes slightly turned out. Inhale as you rise. Exhale as you gently squat down. Do it 8 to 10 times, 3 sets. The third exercise targets the pelvis, lower back, and foot, helping to unload and coordinate these areas. Walk or march with a high knee lift. Move slowly and with control, placing your foot fully on the ground and not letting your knee turn inward. Next exercise, standing on one leg. You can hold onto the back of a chair, make a small inward and outward rotation of the pelvis, gently rotating and stretching. Studies show that doing these exercises 3 times a week for 2 months reduces pain and improves mobility. But there are also a number of alarming symptoms that require you to see a doctor as soon as possible. So what are these symptoms? First, it's a painful swelling of the joint or severe pain at rest or at night. If you experience pain during simple movements, or if the joint seems to catch or lock up, that's also a reason to see a specialist. Or, for example, if there are suspicions of a serious meniscus injury, ligament damage, or another type of arthritis. Remember, even with osteoarthritis, you can live a full life, stay active, and keep your energy up. This was Dr. Dlin with you, wishing you good health, and see you next time.